that you also avoid fake news and misinformation and rumors. On the 19th of March 2020, 4 additional cases of coronavirus disease were confirmed in Lagos State. This brings the total number confirmed in Nigeria to 12. Of the 12 confirmed cases in country, 9 were reported in Lagos, 2 in Ogun State, and 1 in Ekiti. Nigeria is experiencing an influx of imported COVID-19 cases by travelers, including, unfortunately, also returning Nigerians. And this emphasizes the importance of self-isolation for a minimum of 14 days, even if you feel that you are very well. 8 of the 12 cases are travelers from Italy, the United Kingdom, the United States, and France. And 3 cases are contacts of the imported case, and 1 case confirmed yesterday has no travel history at all within the last 1 month, but may have met with foreign visitors. The Nigeria Center for Disease Control is working closely with Lagos, Ogun, and Ekiti state governments to carry out contact tracing. I emphasize that the contact tracing is an extremely important but also arduous task, and I urge all state, local government, law enforcement authorities, and community leaders to give full cooperation to investigators. Following the declaration of a pandemic by the World Health Organization and the increasing spread of COVID-19, our strategy is to detect and isolate new cases as early as possible to interrupt or reduce transmission of infection. To this end, we have scaled up our response efforts, and to reduce the risk of new cases entering Nigeria, the government, through the Presidential Task Force on the Control of Coronavirus, announced prohibition of entry for travelers from 13 known high-risk countries. And for better control of new arrivals, international travel to Nigeria has been temporarily limited to 2 international airports, Murtala Mohammed Airport, Lagos, and Nnamdi Azikiwe International Airport, Abuja. Port health services will be strengthened at these airports. Other airports shall be closed to international traffic, but not to domestic traffic. These decisions will be reviewed as the situation demands. Travelers from all countries shall be required to self-isolate for 14 days after entry, following the guidelines provided to them. Non-compliance puts your family, your friends, and the public at risk, even if you feel very well. As for arrivals from high-risk countries named, their self-isolation shall be supervised in the form of follow-up to be conducted by Port Health Services and NCDC, with the option of doing a testing as need arises. According to our national case definition, we have identified 2 more high-risk countries, Austria and Sweden, who were added in the past 24 hours to the list. We are also including COVID-19 testing in our routine surveillance for influenza-like illnesses. The original index case is clinically stable and has improved greatly. The first test, negative test, was recorded yesterday. We will discharge him if his next test is negative according to the case management protocol. Therefore, as of 20th of March 2020, Nigeria has recorded the 12 confirmed cases of COVID-19. One case has been discharged from the hospital. The other cases are clinically stable with only mild symptoms. Contact tracing is ongoing to identify all persons who have been in contact with the confirmed cases, and it is estimated that there are about 1,300, and they are going to be traced. Port Health Services of the Federal Ministry of Health, in collaboration with state ministries of health, have heightened screening at all air, land, and sea points of entry into Nigeria, and adopted the protocols to reflect the travel guidance issued by the Presidential Task Force for the Control of Coronavirus. The Federal Ministry of Health is working with Nigeria Customs Service and Nigeria Immigration Service to ensure surveillance at land and sea borders. Ships coming in through the seaports are also subjected to mandatory health screening and clearance by Port Health Services, especially ships that sailed from high-risk ports and who have been at sea for less than 14 days or have crew members who are known to have fallen ill. The Multi-Sectoral Emergency Operations Center, led by NCDC, continues to coordinate national response activities. Various states have implemented measures to shut down schools and large gatherings. But however, we must now begin to emphasize the importance of personal responsibility by citizens. I want to say again that those who have just returned from overseas travel will be doing themselves, their families, and the country a great favor if they stay home in self-isolation for 14 days, during which they shall report their health status daily to NCDC on phone numbers provided. This number I will give to you later. But it is to be done whether you have symptoms or not. NCDC published a guidance on self-isolation with clear steps on what to do to stay safe and keep your family safe. We urge Nigerians to wash their hands, avoid contact with people who are sick, and practice proper personal hygiene. Follow the NCDC published guidance on self-isolation. It has clear steps on what to do. NCDC hotlines are active day and night, and we urge citizens to only use this for legitimate reporting and not as a joke. Answers to frequently asked questions have also been put up by the Presidential Task Force on that website. We are continually scaling up the capacity. We applaud the efforts of Lagos, Ogun, and state governments, and Ekiti, Lagos, Ogun, and Ekiti state governments in implementing urgent response activities, and urge other states to do the same if and when this need arises. At the National Executive Council, chaired by the Vice President this week, I urge states to urgently scale up investment at subnational level, especially in contact tracing and usable emergency isolation centers. Citizens are advised to discourage misinformation that causes fear and panic, and not to participate in disseminating false or senseless messages, even if they seem funny. Please accept only information shared through official channels of the Federal Ministry of Health, the NCDC, or state ministries of health. The fight to contain COVID-19 is a call for every Nigerian resident to be responsible with information by accessing and sharing only credible information from the official Federal Ministry of Health, NCDC, Lagos State Ministry of Health, and other state health department officials or channels on TV, radio, and social media. NCDC has a website focused solely on COVID-19. This website is updated daily and has all the information needed, including daily situation reports, guidance for schools, guidelines for health workers, and more. The website is covid19.ncdc.gov.ng. Advice for self-isolation. If arriving the country, ensure that you are picked up by only one person, and you should try to avoid the use of public transport, whether by plane, bus, train, or car. Do not sit in the driver's seat. Maintain at least 1 meter distance between yourself and the driver. Ensure adequate ventilation throughout your trip. Avoid contact with the driver. Do not leave your house during self-isolation period. As much as possible, stay in one room. You should strictly limit your contacts with people, even including family, during that period. And if during your 14-day self-isolation you develop symptoms of COVID-19, such as cough, fever, shortness of breath, or generally feeling unwell, avoid self-medication and contact NCDC through the Connect Center immediately. The number is 0800 97000010. I shall repeat, 0800 97000010. Once again, I wish to urge all citizens to take care of their health and protect others by continuing to do the following. Regularly and thoroughly wash hands with soap and water for at least 30 seconds. Do not, and if not possible, use the alcohol-based hand sanitizer. Maintain up to 2 meters, at least 2 meters distance between yourself and anyone who is coughing or sneezing or has a fever. Be sure you and people around you follow good respiratory hygiene, which means to cover your mouth and nose with a tissue or handkerchief if coughing or sneezing, and dispose of it immediately. Alternately, use your sleeve and cough or sneeze into it if no tissue is immediately available. Do not mingle with people or to congregate, but instead stay at home if you feel unwell with symptoms like fever, cough, sneezing, difficulty in breathing. Call NCDC, a toll-free number available 24/7. Thank you for listening.
Thank you, sir, for the update on COVID-19. With the permission of the Honorable Minister of Health, the question and answer session begins. Please kindly go straight to the point and be brief. Thank you.
NCDC is here. Where's NCDC?
I don't think.
Where?
Yeah.
Should I start?
They should be somewhere close.
Okay. Hello, I'm William Clowes from Bloomberg. Just 2 very brief questions. First relates to President Trump's comments yesterday about chloroquine and hydroxychloroquine. I know that Nigeria doesn't use the first one, chloroquine. And excuse my ignorance, I just wanted to know, is the second one, hydroxychloroquine, still used here in malaria treatment, and is there a concern about availability after the President's comments? And the other one is, could this pandemic, reduce global manufacturing of malaria diagnostics and treatment drugs as we approach malaria season and people prioritize COVID-19 over malaria?
Good afternoon, Honorable Minister of Health. My name is Joseph Kadri. I report for ITV. I have two questions. One is the person that died in Afe Babalola University Teaching Hospital in Ado-Ekiti. That facility is still on. Students are still having lectures or practical in that facility, and the facility will still be on until first week of May. So what is the federal government doing about that, especially when we have somebody died there? Why is that facility not shut down? Then on the aspect you talked about, people should maintain at least a feet whenever they're in public transport, if necessary. In the FCT here, you discover that commercial operators carry 4 behind and 3 in front. What? Yeah, 3 in front. Yeah. So, what are you going to do concerning that? Thank you.
Good afternoon, Honorable Minister. Good afternoon, everyone. My first question is on the issue of procurement. My name is Frank Ajufu from Vision FM Abuja. We were told even before the index case was announced that the process of procurement had begun. I would like the Honorable Minister to update us on the level of procurement that has been done. At the state that we are now, should we have a crisis, do our health workers have enough personal protective equipment to work to avoid the situation we hear in the United States where health workers are asked to repeat face mask? And then another question is on the support for states. Ekiti State has one confirmed case. And I was told from what I heard and watched on TV that there is an isolation center of about 8 bed spaces. A single case has the capacity, considering the level of transmission, which we've been informed about, of spreading the disease very rapidly. The 8 bed space, how realistic is it for Ekiti State? And is the federal government looking at supporting the state to increase the number of bed spaces in the isolation center? Thank you.
My name is Friday.
Let's answer these ones before Friday comes on.
Friday is there.
Yeah.
Friday is there.
So Friday, you wait. Today is Friday, but you can wait. Let's answer these first 3 questions. We take them 3 at a time. First of all, with regard to procurement, we presented a request for the funding as far as we can see. And the government has provided the funding as far as we can see, and the procurement is going on. We are not complaining about any issues with procurement. With regard to the case in Enugu with Ekiti, I also thank you for bringing that up because it's an opportunity to also emphasize the importance of contact tracing to find out, first of all, how many people that case in Ekiti how many people had contact with that case. Find out where they are and put all of them on record and on self-isolation, and for them to continue reporting on themselves and to see if anyone shows signs of infection. The Nigeria Center for Disease Control provides the support to the state government, providing epidemiologists. They may require more people, more staff to bring people on board to carry out this tracing, and that is the best way to find out who all may have had any kind of contact and a possible infection from that one case. The second talks about FCT. Yes, well, if they have I'm coming to that. I think it's coming up. It's further up. The FCT, the advisory I gave is for those who are arriving from overseas travel. I say if you are arriving from outside the country, you are advised to take a vehicle, a taxi with just one person and stay a foot away from that. I didn't say it's for everybody in the whole country. So I need that to be properly reported, because if you are coming from abroad and we do not yet know your status, and you have scaled through the screening at the airport, you have no symptoms, and we know that there is a window in there, you have to go into self-isolation. And when you are going to self-isolation, even from that very moment of transporting yourself from the airport to your self-isolation, try to make sure you are picked up by only one person, and you stay away from that person at least 1 meter, that is the driver. As for the case in Afe Babalola, Ado-Ekiti, that case, that fatality is not reported among us because we could not confirm that fatality as connected to coronavirus. Our testing showed negative for that person. It was done 2 times. So we're not counting that. We're not reporting any fatality on coronavirus. The intensive care in all places need to be prepared and beefed up. We have said that repeatedly. And we hope that the cases in Ado-Ekiti will be also detected and found out. I personally am hopeful that the contact tracing, if done early and fast, will yield the suspects, and at the same time hope that that is not a large number. But wherever support is needed, it will be provided. The other is about chloroquine. We no longer use chloroquine in Nigeria. His Excellency President Donald Trump made his own announcement, but we are not following that announcement. We look at what the World Health Organization recommends. We also ask our own scientists here what their recommendation is. And so far, there are things that have been said about chloroquine, that it was active in vitro tests and not proven to be active in vivo. That's what we know so far. The situation might change. So we are not necessarily going to look at that, but we are not ignoring it either, the possibility and the option. But of the cases we have so far, we have not been in a situation where we required to use chloroquine or any medication, largely supportive treatment.
So what is in vivo? What is in vivo?
For those who don't know what in vitro is and in vitro means testing outside the human body, outside on the surface. It appeared to be active. In vivo means actually testing it against the germ inside you, and it has not been proven to be so active. That is the information we have so far. As for hydroxychloroquine, we don't generally use that for that purpose, except for some immune situation. That's all. Next questions, please. Friday can come on now. It's your turn.
Today is Friday now.
Anybody call Saturday here?
Thank you. I work with Channels TV. I would like to ask 2 questions. The first one is our insistence on self-isolation. You use the expression that we have witnessed influx of imported cases. Of course, the 12 cases were imported. Why are we still insisting on self-isolation as against what some other countries are doing? For instance, our sister country, Uganda, they are not practicing self-isolation. It is compulsory. If you are coming from any of those high-risk countries, it is compulsory that you will be isolated and you will pay the cost of the isolation. That is their own style. So why are we insisting on self-isolation, considering the kind of people we are, with all due respect to all of us? And then the second one has to do with our isolation centers. How many isolation centers do we actually have, and what is their capacity? How many suspected cases can they really accommodate? Thank you.
Yes, my name is Fred. I work with Sun River. Just yesterday, World Health Organization raised the alarm that we are getting to a point that we are having community transmission. Understand? They mentioned 12 countries specifically having the case of community transmission, and the And this spread is becoming so alarming that government needs to sit up as regards containment. My question now is, Honourable Minister, have we reached that point of community transmission? Thank you.
Good afternoon, Honourable Minister. My name is Ogom from AIT. Quickly, I want to find out what's the cost for a testing kit? And secondly, why don't we have a place, maybe a general hospital where we can go for tests? I'm saying this because yesterday we did an investigative inquiry, and what we got from the call center wasn't okay at all. First of all, the lady who received the call and told us that she's only considering us because the person in question came from Lagos. If not, she wouldn't have considered us at all, which wasn't right. And we went further to ask her, what do we do now that we are suspecting a case? She said, just put the person inside a room. Just keep the person in a room. For me, I don't think that was necessary. What she would have told us was either take this person to a general hospital or otherwise, but there was no information. So I believe that those manning these call centers are not well informed on what information to give out to the public. Thank you.
Okay, thank you. Let's answer those ones. With regard to the last question, we're not charging anybody for the testing kit, and we have not charged anyone to pay for the testing kit. But there are criteria to be tested, because these testing kits are scarce, they're expensive, and we are not going to expend it on anybody who comes and say, test me. That will not work, because no country can afford that. There's one country that wanted to test everybody, and very soon they discovered they had to abandon the idea. It's not possible, because they collected samples from everybody and sent them to the main laboratory, and very soon their test kits were gone, and they didn't get. But you see, you must fit certain criteria. First is that you must have been outside the country within the preceding 14 days, or even if it's 16 days, we'll accept. If you haven't been, then you are not eligible. Second is that you may have been in contact with somebody who has been, a close contact with somebody who has traveled within the preceding 14 days, and that person either has been tested or has not been tested or has tested that is positive. If you fit those criteria, yes, definitely you'll be invited to test. Otherwise, you have to stay in self-isolation. If you have traveled and you have no symptoms, and keep reporting. Immediately you have a symptom, you can call and say, I traveled within the last 2 weeks, I just came from abroad, and I'm not feeling well, and I'm feeling very sick, I have fever. Then immediately you will be given attention for testing. For the transmission, community transmission, yes, that's a high risk, and many countries are already suffering community transmission, which is why we in Nigeria, every country uses its own strategy. As you can imagine, it's foolish for one country to try and copy what the other one is doing. You are going to lose seriously. So we have our experts here, public health experts, and epidemiologists who know the way diseases are transmitted, who advise government, advise us. I myself am not an epidemiologist, on the best approach. Therefore, our strategy here, knowing that this condition of our health service, is to be fast and aggressive in finding out any possible case that may have entered. That's why we insist on self-isolation, we insist on supervised isolation, and we do testing, and we do contact tracing, and admission of people who are positive immediately into treatment centers. The Ugandan style, where the Ugandans have developed their own based on their own peculiarities, their own needs, they will not copy us, and we will not copy them. We look at what each country is doing to see if we need to copy or if we need to borrow a leaf from it. But we are not taking hook, line, and sinker what one country has adopted, because everybody knows its challenge, everybody knows how the shoe fits. The question of self-isolation, I think, is very important. It's something that is critical for our own strategy, in that a person who comes in on an airplane from an infected country, and as it is now, over 160 countries have cases. We do not know if he's carried the infection or not. And our first priority is that if he's carrying it, then and he has not manifested it, then he needs to be in a place where he has the least possibility of spreading it to others. If he is not infected, we also don't want to imprison him in an isolation center where he will be very uncomfortable, or he might not feel at home. Somebody is coming from a long journey, you lock him up. So we decide that he can go home, but understand clearly and cooperate with self-isolation. Now, if he shows any symptoms of being unwell, we immediately bring him in for testing, or rather we go and take sample and test, and if it's positive, we take him straight away into a treatment center. I think that answers your question.
Number of isolation centers.
Yes, the isolation centers, first of all, we have isolation centers for various kinds of other diseases. But for coronavirus, every country is scrambling to build isolation centers. You know that China built its own 1,000-bed center in 10 days. That's them. But every country is scrambling for that, and we are also doing our own part. We have our own strategy to increase beds and also to sometimes improvise if need be. There's a standard isolation center going on in Gwagwalada. There is one already in Lagos, a very sound one, which was inherited from the coronavirus, the Ebola virus case that came into Nigeria. So they are very stable. And there are other strategies we are immediately working upon to develop isolation centers if the need arises. We're working seriously on those ones, including requesting our teaching hospitals to immediately make wards available if the need arises. But I will say that no country is ready. There's no country that tells you they are ready. They were ready for corona. All countries are really adapting and moving, and it depends on how fast you move and how calculated your moves are, that you can be able to control the epidemic or the threat of epidemic.
Okay. My name is Femi Atoyebi. I write for Punch newspaper. Honorable Minister, let me take you back to the issue of isolation center. I want to ask, how involved is the federal government in setting up isolation centers for state government? Because some of the pictures we have seen coming from the state government, what they call isolation centers are pathetic sites. I want to know what federal government is doing in helping state government to set up isolation centers, especially in terms of equipping the place and identifying a site for it. And then my second question is, at what stage will Nigeria activate quarantining instead of self-isolation? Thank you, sir.
Okay, good afternoon, Honorable Minister. My name is Moses Emorinken from the Nation newspaper. Mine will also be a follow-up from some of my colleagues on self-isolation. I mean, it's too critical right now that we have to make it very, important for everybody coming into the country. But my question is, sometimes we assume that everybody belongs to a certain level of standard of living. I tell you that some people, even if they are coming from abroad, they don't live in environments that they can really effectively self-isolate. Some people live in face me, I face you, yes, even if they come from abroad. Some people live in a 2-bedroom flat and they have kids and have families together. So I want to know if we are going to beef up our strategy for self-isolation. If the government is going to be involved in creating, if at all, create some isolation centers where these people can stay instead of, being threat to some of their family members because they don't have enough room for that. I think that's all. Thank you, sir.
Onyebuchi, I work with this newspaper. The minister, I want to talk about the treatment being meted out to those who are on isolation. That's isolation centers. We had an incident of what happened in Enugu. And the family gave a press statement on what they thought was what they neglect on their mother. Such cases, if allowed to go without a government trying to put it to rest, might discourage some people. They may see those isolation centers as death caves, because I know how what my question is, what standard are we trying to insist on for health workers or health officials that are to attend to those on isolation center? Because sometimes you go there, some might starve to death, some might not receive normal treatment because everybody is scared. Do we have any standard method of attending to them so that we can have it all around, so that people cannot suffer unnecessarily for this kind of situation?
Okay, well, thank you. I'll start from the last one. First of all, you must not imagine isolation centers to be prisons. When you say some are starved to death, Enugu has had only one case. And the other case we had was in Ekiti at the moment, and then Ogun State, Enugu, Ogun State, and Lagos. So when you say some, it looks as if you are generalizing, and that's not quite accurate. You must know that many countries are trying to adjust rapidly to this threat, trying to adjust rapidly. Now, I do commend the family of the case that came into Enugu for being proactive in noticing that their mother came from travel abroad and noticing she had a temperature and taking necessary step and to approach the government or the health authorities there. And they apparently used whatever they had at the moment. We didn't know about the kind of facility they had. And the focus at the time was, is this person positive for coronavirus or not? And once they established that it was not positive, they discharged the patient. What happened subsequently, we didn't know. But I will say that part of the task that the Presidential Task Force on Control of Coronavirus has taken up now is to urge states to have, even if temporary, isolation centers that will meet standards. That's part of what the task force is looking at, because as I say again, nobody is ready for it. The isolation centers we have in all states refer to other disease patterns which you cannot put coronavirus with. So you are creating practically a new infrastructure for this particular kind of problem. So while we really do sympathize with the family, if that is where it actually happened as we are reporting, we do believe that it's a learning moment for everybody to know what to do and to respond in this case. With regard to the self-isolation of persons, I have stated that the self-isolation is actually a social responsibility. I have said that it is the interest of the individual, it is in the interest of their family, it is in the interest of their neighborhood and the country for them to self-isolate and use any method. We are not going to inspect your house to find out. And in my statement, I did say that if anyone needs to self-isolate, they should, as much as possible, stay in one room. Completely do not take visitors, so that you limit the number of people that stand a risk of being infected. So that remains a social responsibility of the individual to find out how they can do their self-isolation in their own room. I also know people who have called me and said, there are many of us who live in my house, I don't want to endanger them. So they want to go and take hotel room. They went to go and rent a hotel room, small hotel room outside that they rented. Now I call that social responsibility, individual social responsibility, in that they don't want to endanger their family. So that's what that person did. But I also know that there are people who resist any kind of being taken to an isolation center. They resist, they don't want to go. So those ones can also take a hotel room if they cannot take the other option. Now, we have said that isolation centers, we have got plans. We have got plans to increase and build one. I mean, many of them. But that cannot be realized within the next months or years or year. So we are talking about how to deal with the situation now, as it is now. Isolation centers will spring up, you will see them. Testing centers will also spring up. But before that happens, we want to be in control of the epidemic now, at this stage. Now, anybody who's on isolation, supervised or self-supervised, is going to be observed by those who are empowered to do so, NCDC and Port Health Services. Once you are positive, you are taken to infectious disease hospital, you are said to be in quarantine because you are now under treatment or being observed. In some cases, people who are very uncooperative have been known to be taken by authorities to forced observation centers. If they are not compliant and they turn out to be a risk, they can be taken by force to a place where they are supervised until it proves that they are negative. Some countries do that. I think that's it for now.
This will be the last set of questions. Just 3 people.
The federal government will support states and in isolation centers. And many of the isolation centers you have in states were either not used for a long time, so they were not in use, or they were used for other disease patterns, like Lassa or whatever. So, and probably do not fit the needs of the present requirement.
Yeah, Honourable Minister, my name is Anule Emmanuel for Agence France Presse. Sir. Considering that we have, we now risk local transmission, I just want to find out from you, sir, what is the government doing to increase the number of ICUs and the number of bed spaces that we have in these ICUs, and also respirators? Thank you, sir.
Good afternoon, everyone. My name is Amaka Ode from Arise News. Well, you sort of answered one of my questions in terms of the supervision, the level of supervision, especially for those who are self-isolating. But my next question would be about our testing facilities. As it stands right now, we only have that are able to really test for the COVID-19, which are, if I'm correct, Lagos, Edo, and Abuja. I want to find out what we're doing to really upgrade some labs, even if we don't have them all across the country, at least in the geopolitical zones. I believe that would help us, in fast-tracking these samples when they're taken to the labs and get the results as soon as possible. And this will help us reduce the number of contacts that these people have, especially if they know they're positive on time. Thank you.
Good afternoon, sir. I'm Ojoma Akov Idoko from Daily Trust. My question is on private hospitals. How do you intend to include private hospitals in the COVID response? Are there some designated advanced hospitals you intend to work with? How are you going to strengthen them? Then secondly, there have been uproar, especially in the Senate, about the number of testing centers for COVID-19. For instance, in the whole northern states, there is no testing center except they come to Abuja, the southeast and all that. How do you intend to expand the number of testing centers for COVID-19?
Just one more question.
Good afternoon, Honorable Minister. Nkeshonye Ugeze is my name. I work for The Guardian. I want to find out whether you are considering having a kind of random test in all the households that, where this foreign trip have been completed. Are you considering it? Because there might be some undetected cases, maybe due to contact with someone that returned that might not really self-isolate. Then number 2, I want to also find out how many respirators do we have? How many of them are working?
Okay, thank you very much, everybody. Some of the questions are quite related, so we shall address them and address one, address the others. First of all, with laboratories, when the COVID-19 first came into this country, we didn't have the capacity to test at all because, as you know, it was called the novel coronavirus, new. We didn't have a facility, and at that time our option was to take sample and send to Johannesburg for testing. Working very hard, we were able to get the reagents, and I will tell you that testing for coronavirus requires a special machine. It's a molecular diagnostic machine called a PCR, but you need a specific reagent that will identify this virus for you. So even if you have the machine and you do not have the reagent, and then you have not trained your staff, you can't use it. So you have to do a training, and then you have to make the efforts to get the reagents. The World Health Organization was quick to come and help us with training. Immediately we had acquired the first reagents. And the testing at that time was done in Abuja, Gadoa, reference laboratory. Since then, we were able to do this test in 5 laboratories at the moment, 5. And we are looking at getting more reagents, and reagents are getting scarce because many countries are running for these reagents. And we have an offer of a PCR machine by one of the Middle East countries that want to give us one, which we want to place in Kano, where there is a gap. The 5 we have at the moment that are able to do this test, there are 2 in Lagos, that's the Nigeria Institute of Medical Research, the Lagos University Teaching Hospital, in Abuja, Gadoa NCDC. Then there are 2 research centers. One is in Ede, and one is in Irua, Edo State. Those are research centers for... That's Ede is the town. It's in Osun State, but it's in Ede town. But the one in Edo is in Irua, in Edo State. They are research centers, and they're able to do these tests. We are hoping that if we get more reagents, we shall train persons to also do this test in Abakaliki, because the machine is there, but you don't have the reagents. And I think Kano and Maiduguri, once we are able to get more reagents and do the training. So that's the capacity. And we can also include other centers where we might have PCR machines, so we're able to get PCR machines. But even the one promised us has not arrived, and that will take time. So we better reckon what we have. Meanwhile, NCDC has a very sound transport mechanism where they collect samples and send to the centers. So the patient doesn't have to physically go there. So all they do is take the samples, and they have a good courier mechanism, a courier company that works very efficiently and takes the sample to the testing center in a very short time. So that's adapting yourself to the situation you are in, which is very good. And so any sample taken anywhere can be sent to a testing center in a very short time by the courier company, which the government pays for. Now, as for local transmission, that's why I keep saying that we need to hurry up with our testing abilities to give support, particularly to Lagos State, where the majority of cases are being followed up, majority of contacts. Because the more you can get the contacts, and the more you can test them and find if they're positive or not, and put them under self-isolation, the more you can reduce the risk of them transmitting the disease to anyone. So that's a very important step indeed. And the more you're able to find all the contacts, test them, make sure they are not infectious, the less you will need an ICU, because you have fewer cases, you have fewer patient load. So that's why our strategy is on prevention. First of all, identifying those who may be coming from abroad, and of those who have arrived, tracing, and somehow or the other were not caught because they didn't have symptoms, tracing them and tracing their contacts, and finding all those who are positive, put them on observation, testing them, putting them in treatment, and to reduce the risk that we have. Because if you do not do that, each one infects the other, and the infection will spread, and you can easily lose control. So our emphasis is on that. And random tests, well, the criteria, because we have limitation in test kits, the criteria we use now is that, 1, you must have traveled in the 15 days before. 2, or you may have been a victim, or rather a contact of a person who traveled, a close contact who just came, or you have symptoms that indicate that you may have coronavirus infection. So you'll be tested. But random testing is going to be like you go hunting and start shooting into the bush, hoping that you will kill something, and you may end up with nothing. Better to aim and identify and do a more targeted use of your scarce resources. Private hospitals, yes, we know that private hospitals offer 50 to 60% of consultation to Nigerians, which is very good. They are a very powerful factor and very powerful partners in the healthcare system. So they are very, very good. And we know that a good number of patients, first of all, report to the private centers. Now, the private centers may not have, most of them don't have the facility to treat a highly infectious disease like that. And they will definitely not have a laboratory for it. But in that case, we urge private hospitals, if they have a suspected case, to refer them for diagnosis. If you can hold them in isolation while getting your result, fine. Otherwise, you can refer them straight away to a center for isolation of suspect cases and get the test done and let the patient be treated in a designated IDH. Now, this is a highly contagious and infectious disease, which if you don't have a protocol for treatment, you can infect your staff in the hospital, you can infect other patients, and that will not be good. So it's better to go to a designated center instead of running the risk of having local transmission within your own private facility. So we do advise, yes, if you're a private practitioner and you get a patient who is suspicious or suspected of infection, send for testing and then send to a designated treatment center. If there are any private hospitals who wish to set up facility for treatment, well, I think they will be inspected by the relevant authorities to see if it meets the safety standards and need to be accredited to handle a disease as dangerous as this, because it's one of national security concern. Thank you, everybody.
Asking the number of respirators. Somebody is asking the number of respirators.
Yeah.
Sorry, sir. I have just two questions. One is a question. The second one is a clarification. I know that with our increase, sorry, my name is Rabi Abdullah from the NTA. I know that, with the increase in our case detection and reporting, this means that we really have to step up our acts in terms of contact tracing. And I know that we don't have enough personnel for that. The national broadband was launched just yesterday. I want to find out. We know that, technology is such that we can use it to close the gap in human resource for health. And the same thing applies in this case. I don't know what you're already doing in that regard. The effectiveness of the broadband in this regard, in deploying it to contact tracing and all of that. Then secondly, I need more clarification on the incident in Ekiti. I'm coming from the fact that, yes, the young man from the American was said to have died from complications. If the driver who drove him to Ekiti later on tested positive, that means the American had COVID-19. If he now died in that hospital, and you're now saying, with due respect, Honorable Minister, you are saying now that it's not a case of COVID-19, because we've had, reports emanating from the Afe Babalola University, where students are saying they don't feel safe being, kept back in that, institution in view of what had happened. Why is Afe Babalola University still in existence after what had happened? Thank you.
Well,
hello. Honorable, good afternoon to you. My name is Dr. Rafa Ayemere, MD Solution Magazine. If you observe, COVID-19 has become a global threat to our economy, health sector, religious organizations, and even
our human existence. If I may ask, are you sure we can win the war against COVID-19?
Well, thank you. That's a philosophical question, but I think I'll say something. But in order to come down to NTA's question, first of all, I do agree with you 100%. Our strategy is detection, not only detection, early detection. They do say that if you are not strong, you must be quick. And we want to be quick in detecting our cases and also aggressive in doing constant contact tracing so that we identify any seeding of the infection that has taken place as early as possible and reduce the case load, hope to reduce the case load. So we are following that. That is the job of NCDC, working with state governments. Every state has a public health department. Finding the cases as they come in is the work of Port Health Services, and they are also trying very hard to increase their presence at the airports. As you know, the government has now reduced international flights to 2 landing sites to create more focus on those who are coming into our country, and also placed certain restrictions, put certain restrictions in place. As for the Ekiti case, the testing we have done was, the first one was, they said it was inconclusive. And we asked for a repeat. The repeat came negative. Negative. And I think, if I remember correctly, that it was done a third time and it came negative. So we can only say it was negative. Now, the indices on ground is that that gentleman had also spent time in Ibadan, before going to Ekiti. And the driver, if he is positive, which is the case, of course it looks like a puzzle, but we must not assume that if he's positive, it must have been... Is he positive, sir? Sorry? Is the driver positive? Yes. So why did he call it? That's the question. Now, you cannot assume that he must have got it from that one person, because I believe, if I'm correct, it's a taxi or something. And I do not know. And if it's a taxi, we do not know who else he was in touch with. We do not know what kind of taxi it was, whether it was an airport taxi. And we also know that this individual was in Ibadan. And what the driver did there in Ibadan, who else the driver may have been in touch with, we do not know. We also have a case in Lagos who is not known to have traveled at all, who is not a contact of any known case in Ibadan. In the United States, they also have cases like that of people who are not known to have been anywhere in China or to have been in touch with someone who traveled. So this case is still being looked into. I told NCDC to continue looking into it. But the indices we have now is that, just like in Lagos, where we have a case confirmed positive of a person who has not traveled anywhere within several weeks, I think, and who also is not known to be a contact of any of the cases we are looking at. Now, we also have a person here who is positive, but the one we are suspecting to be is negative. And remember also that the deceased person is said to have had another caregiver who was even closer to the deceased, even closer, because a caregiver, and that one is negative. So we are assuming things if we believe that he must have taken it, that disease must have been positive. That's an assumption, and that is not the way we are looking at it. Otherwise, the other person who's a caregiver, more intimate contact clearly, would also be positive. But we're still trying to unravel the mystery around it. It's going to be part of the contact tracing that is going on. And this contact tracing will go to Ibadan, where we know that they spent time also. As for winning the war, well, every country is struggling to deal with this disease. We know that some countries were probably slow to actually realize the problem. Others were very quick. Some countries have claimed that they have taken care of everyone at every country, that every case they found has been tracked, and no deaths, no fatality, and they are almost effectively blocked importation. In the news today, it is said that China also had no new case. So it looks like they have won. But there's also a warning against what they call re-importation, because people travel and move around, so you might have a new wave coming up. Now, we listen to all of these and we learn our lessons. We try to adapt all those to our situation, to our country. We look at our health system. We trying to beef it up, to strengthen it up in the areas where we need to. And I'm optimistic that if we continue to be vigilant and to take all the measures that our experts advise, because we are working with our experts, they advise us, then we shall also win. The President has set up this committee, Presidential Task Force on Control of COVID-19, which is also bringing all other factors, factors regarding flights into the country, the economy, the assets we have on ground, the strategy for containment. We are talking about containment now, and then the strategy for managing the cases, and also what is the fallout from the cases, because the economic fallouts that are involved. So we believe that that will work. We have about 350 intensive care units. And well, I can't give you the figure because we are not, but we have a good number of respirators, and they are also on our shopping list. But I must also tell you that the cases we have treated so far did not require any respirator. And it is not every case, only a very few who require respirators. Very few. And probably there are those who already had, those who probably had underlying illnesses that require, but not everyone. But definitely we are also keeping a good lookout for respirators. They are on the shopping list, and we also have plans that if they are required anywhere, they can be moved from one place to the other to where they are needed, because you have to use a strategy that is available to meet your needs. So if a place needs more respirators, we move them there, and if another place needs, so we are ready to be able to move respirators to where the need is. Thank you.
Thank you, sir. Honourable Minister for Health, we've come to the end of this press briefing.
You're watching Channels Television, your home for the news, a live broadcast from Abuja. The Ministry of Health's response to COVID-19 in Nigeria. And of course, dissemination of relevant information is critical to the war on COVID-19, as Channels Television, our website, .com has the latest. It's back to our regular programming. Up next is Business Incorporated.
You've been watching a live Channels Television event.